Welcome to my podcast. Today I'm going to talk about another common case that you can face in a clinical setting on the A&E. Basically, after you introduce yourself, as always you agreed, double check the patient name, date of birth. You will ask the patient, how can I help you? The patient may be depressive, maybe lost their employment, maybe lost a husband, or lost a spouse, maybe lost loved ones, maybe having issue in their life at that moment of time. Maybe they are very stressful and are not feeling sound in their mind, and they are mentally affected so badly. So what I'm trying to talk about today with the update of NICE guideline about how to raise awareness to know the scale of the problem, if the patient having something in a way, also to increase the knowledge of the risk factor and to be aware of, and the importance, of course, of the doctor-patient relationship whenever it comes to feeling low or suicidal or any sort of that kind. It's always portrayed by the social media or the media in general that doctors, they're there to prevent death in many forms. However, it can be only true when it comes to mental and physical health. But if someone wish to take their life or planning for something, no one can know, because it's only the patient or whoever planning to do so who's planning this. And of course, it just depends how many attempts they have done, if they have left a note, if they have like support in their life, whatever, and the potential which could lead to plan such a thing. And of course, there is a difference between self-harm and attempting suicidal. Usually self-harm is just to bring attention for what's going on or to protest something. However, when it comes to suicide, it's basically if you had, for instance, has done it more than once, if you planned somewhere away from everyone, or you left a note and you bought the tools that you're going to use. All of that, of course, will contribute to the way how they plan it. So, as I say, media is always portraying how bad doctors are who failed to prevent death. And in this talk, I'm going to talk about that kindness, compassion, empathy are the key core for any therapeutic doctor-patient relationship. In a way that to get your patient engaging and responding to you. So you need to be full understanding, showing kindness, real kindness, just not fake it. And you need to be attentive, listening to your patient and look to them into the eye rather than staring at something that being distracting. And the patient here, you will feel that you're not listening to them and they might lose their interest and they will just call you a bad doctor. So this brings me to talk about certain risk factors being identified. Say, for instance, like chronic illness, chronic pain, and when it comes to gender, say smell, if anyone had childhood bereavement, if there is high degree of emotional pain with negative thought, also if there is a history of poor physical health, and also it increases in the elderly when they are alone or lost, of course, they went into retirement. And of course, if it's younger age group who might lost their jobs or become unemployed. And also it's been stated that anyone has depression or the reactive one. And also if there is a panic disorder, OCD, obsessive compulsive disorder, has been linked so strongly as well. And also the mental state and the marital state as well, if the patient is divorced or widowed or single. also if the patient is using or misusing drugs or alcohol, and if there is also a history of criminal record and a history of insomnia. And when it comes to social class, there is no distinction between them because it can happen any social class, because usually we know before it's the low social class or the partially educated. However, it can happen to professional as well. And also if there is any personality disorder, psychiatric problem, and if there is any previous attempt in that regard. However, studies shown that females are more likely to report a history of self-harm in comparing to her counterpart men, and 60% of female occur below the age of 35, whereas in men it peaks after 35. And it has been stated and shown that the risk increase with urbanization and increasing living standards. And if the patient, for instance, in a supportive relationship, whether it's spouse, friends, family, and there is low risk. And of course, the marital status, it has been stated as it's protective if the patient is married and in a stable relationship. So the favoring factor attempting suicide can include isolation, the timing of performing this, suicidal note if it has been written, and of course anticipatory acts and how dangerous the attempt they used. So when you need to assess your patient, you need to think about what was the intention or the motive of the patient. Do they really want to die? What's their current issue or problems? Is there any psychiatric problem? And if there is any medication they are taking? And of course, you need to hand them with and equip them with the helpful resources like crisis team, Somatrine in the UK. So you need to tell them about those resources whenever they feel like they're very alone and they're not able to cope and they're out of reach, so they can call this number and talk to someone. It has been shown that suicide account for 1% of all death, and it increased mainly in elderly and in young men, as it's the second cause. And the common found used ways in the UK, whether for men or women, mostly is hanging, strangulation, suffocation, which account for 60%, according to a study in 2022. And the second way is self-poisoning, which account to the rest, obviously, 20% in 2022. However, in contrast to the ways used in the US, it has been found it's kind of fatal, brutal, and very violent, like firearm. So, in brief, I just stated about what you need to consider if a patient is low or talking with negative thoughts or not acting their ways or feeling or having issue in their lives like stress or something. You need to explore around all of those I stated and take them from there. And I hope by this I added something to the suicide and risk factor, how to assess, and what you need to always consider is being understanding, thoughtful, compassionate, kind, and welcoming the patient in order to engage with you and open up, telling you what's going on in their life. Thank you.